Next, I have the pleasure to introduce Danny Scalise, who is going to introduce our keynote speaker for the day. Danny is the health director in Burt County and also is a member of the NCIOM board.
Good morning, everyone. A little better. You've had some coffee. Good morning, everyone. There are times in your life when you're early in your career and things happen and you don't really understand that they're going to impact you some other way. I was a young public health professional, had just gotten the job as the health official in the county I grew up in West Virginia. And my mentor took me to a NCIOM meeting. And as we were wandering through this monstrous hallway, he introduced me to one of his friends. And he said, "I'm Umair." He was a very pleasant person. Very interested in me, very, very good to talk with, and I just didn't think much about it. As we were leaving, my mentor that was with me told me he was the health official in Harris County. Now, Harris County, Texas, if you don't know, is Houston. I did not know that at the time and said, "Why is that a big deal?" And he said, "Because Harris County, Texas has 3 times the population of the state of West Virginia." So I paid a little more attention to him. Over those years, Dr. Shah and have I got to keep in touch and seen each other at multiple conferences, events, things like that. I've come to call him a friend of mine and a mentor to me. He left Harris County and went to the Washington State Health Department, where he led a fantastic team at a really tough time during COVID. He is one of the few friends I have that has an IMDb page. He's been on a few TV shows. And is somebody who always takes my call, is a friend and a mentor, and I was tickled to see that he was coming here. So please give a big North Carolina welcome to my friend, Dr. Umair Shah.
Now I'm going to be all choked up. Gee, Danny, thank you for that warm introduction. It's just fantastic to be here and back at you. I think is probably the best thing I can say. Let me move this water because I will drop it on the laptop and that will not be good. Let me just start by just dispelling the rumor. It's out there, so I'm just gonna start with it. Yes, I left my wallet at home yesterday. I got to the parking garage at SeaTac Airport, Seattle, Tacoma Airport, and I got out of the car and I had my cell phone in my back pocket. It was not my wallet. I thought it was my wallet because the heaviness was there. I had 2 choices. One was to contact Michelle and others and say, "Gosh, I'm going to take a later flight and not quite get there." The other was to just charge ahead. And I hope you understand the kind of person I am because I just charged ahead. Now, the background is I did have a backup ID somewhere in a backpack that I had. But you know what? The funny thing is I never used it. I went from Seattle to O'Hare in Chicago. I used TSA PreCheck Clear, went through without actually having to ever show an ID. I got on the flight. I had everything on the airline app for purchase. Got to O'Hare. It was on my phone. It was on my smartwatch to do Apple Pay. And I got to North Carolina. I got in an Uber. Guess what? Did not need to show an ID until I got to the hotel. And I was about to put my mind to rest for the night, and I thought, oh my gosh, they want my ID, and I don't have it. And the reality is they were actually going to take it off my phone. But I just wanted to share that story because, one, I wanted to dispel the rumor that I have it all worked out. So, Danny, I wanted to make sure to correct the record there. But number 2 is I wanted to just share the fact that the world has changed so much that you can actually get on a flight from Seattle to North Carolina. And I know I did. Actually, 2 flights. And you can be in a digital age where you can traverse the entire country without having to show your physical ID. And I want you to reflect on that. Because 5 years ago, 10 years ago, 20 years ago, that was not the case. And so the world is changing, And we too, in our health sector, must change with it. So it is great to be here this morning. Yes, I still don't have my ID. I did call my wife. She did tell me a lot of choice words about what I was supposed to do yesterday morning before I got on the flight, which was not to be repeated. But I just want to just say what a pleasure it is to be here today. And I do want to do a couple of shout-outs. Obviously, Secretary Sangvai has left, but I really was inspired by hearing his words of where we are here in North Carolina. Cody Kinsley, John Weisman, Hugh Tilson, John Lumpkin, Danny, who you're going to hear from again, Mandy Cohen, Susan Consagra, Danny Staley, Dr. Greenblatt, a number of, and I'm sure I've left out a number of friends and colleagues. These are real leaders in the space of health, and they have been leading for years, for decades. And I just cannot say enough about the incredible talent that is in the state of North Carolina. So if you could join me in really recognizing the talent of these and other leaders across this great state, because you are so fortunate to have them here. Okay, we are going to be talking about resilience, and I am going to be giving a presentation that is going to be different than what the rest of the day is today. So you have all the data, right? Here it is at your tables. Everybody have this? Have a copy of this, right? This is the stuff. This is where the meat of everything is today. And I know what you're going to be doing today is going to go through all of the different indicators and metrics and measures, and you're going to be making good use of them as you work towards this Healthy North Carolina 2030 convening. What I'm going to be doing is, one, I'm going to get you all excited. So revved up. How many people have had your coffee? Ooh, Danny, not good. I mean, didn't I just tell you the story wait a minute, I missed Lisa Harrison. Where's Lisa? Woo, okay. Lisa, woo! Sorry about that. I have to say, when you lose your wallet and you actually show up across country, I mean, when I say talk about coffee, you guys should be a little bit more excited. I mean, come on. Woo! Okay, there you go. All right. So I'm going to be going through a presentation where I'm going to be speaking very little about data. I'm going to be painting a picture and a story of where we are today. And I want to give a national perspective. Danny talked about I was in, as what you would recall as being a red state, Texas. And I did the public health work on the ground for many, many, many years before Governor Inslee asked me to be the Secretary of Health for the great state of Washington, which, as you know, on a map is quite blue. And I actually arrived the week that COVID vaccines were rolling out. That was my transition from Texas to Washington. Not the best time, ER doc. I guess it's okay to be able to do some crazy things. My wife didn't think that it was a smart move. I didn't listen to her. I probably should have. But I got up there and I realized that the themes, whether it was red or blue, were quite similar. And that's something we need to be thinking about here as we think about today, because there's a lot more that unites us despite what you hear in the popular media or the social media that talks about what divides us. And I think all of us need to be thinking about how do we bring people together. So, Resilient Together, the heart and hope of public health. That is a AI-generated image of Raleigh. Doesn't it look great? Isn't that nice? I was excited. I was like, this is great. Anyway, I just love the color. I was just, yeah. You thought I was doing that, right? Like my 9-year-old, who, by the way, his birthday is Sunday, he was like, oh, I can color it for you. I was like, nah, I'm going to let AI do it. So it's good. I also want to recognize that recently I joined faculty at Columbia Mailman School of Public Health, and I'm going to be teaching a course this spring called Navigating Health in a Divided Nation. It's going to be the skill sets that our students need, from podcasts and debate, and how do you look at social emerging media, AI, technology, this real notion about how do you navigate health. And I want you to be thinking about that theme as well. Okay, so 2 decades of service. Let me just get this out of the way. It was a long haul. People ask me, it's been 8 months, are you regretting and missing being in public service government? And the answer is yes, I am. However, the answer is no, I'm not. Okay, by the way, I can say whatever I want now because I do not work for a government. So I can say, so this is the time to ask me anything, and I am going to tell you exactly what is on my mind. So from an ER doc perspective at the VA hospital at Texas Medical Center, in 2005, not 2015. On the bottom left, Hurricane Katrina response, where just came out of the ER, and we had 27,000 evacuees at the Astrodome, the largest sheltering operation in the history of the continental United States at that time. And I asked for a Form 214, this is in the official records for Katrina, that was not about new widgets or things, but to actually ask for common sense. And common sense was what was missing as we did our responses throughout. And I'm going to talk about Hurricane Helene in just a moment. And I just want to remind everybody of how important it is that when you are responding on behalf of others, that's one thing. But when your own home, when your own neighborhood is underwater, it is a completely different perspective. And I want everybody to remember that as well. A lot of things that you can see up here, you have President Biden, you have President Trump. So I've met both sides of the aisle, and I know many of you have, and we have to be thinking about how do you work across aisles. That is something that is so important to the work that we do. And then most recently, in March, I launched Rickshaw Enterprises, and I can talk about that in a moment as well. So I'm going to ask this question. What drives you? Did you wake up this morning thinking that a guy's going to get up here and ask you a question like that? But it is the question. And I didn't take this from a car company, the relentless pursuit of something else. It should be the relentless pursuit of health, that incessantly we should be pursuing health because we know that health is the heartbeat of society, that it impacts everything, that whatever we do when we are healthy or healthier, we do better with all those other things, whether it's in our work lives, whether it's our social lives, whether it's our family lives. We do better when we are healthier. And that is the case for all 11 million people across this great state. And we have to keep that in mind. Yet, health is inherently political. We know that. We see that. Does not have to be partisan, but it is absolutely political. And so the first thing I was at, I don't know how many people were at APHA last week, American Public Health Association annual convening, and some student came up to me and made a comment, I didn't think health was political. It's like, what school are you at? You need to take my class. Health is inherently political, and we know it's inherently political because we see it every day, right? We see with even the MAHA report that came out, Make America Healthy Again. We saw it with Secretary Kennedy and all the things that he has been doing or the administration been doing related to health. We have seen it very much of recent in the longest shutdown in the history of the United States, where everyday people were impacted. Every day people were impacted, and yet both sides continued to dig in. Both sides, and don't take a side here, folks, both sides, all sides continued to dig in, and we have to figure out a way beyond that, and that is critical for us. Change is the one constant. We have it all the time, and the road in public health is long. It does not sleep, right? Just because you had a hurricane doesn't mean the next week you can't have another one. And we saw that. Hurricane Katrina happened in 2005. We had people at the Astrodome. 6 weeks later, Hurricane Rita came. And all of a sudden, we were evacuating the evacuees. It does not matter that it just happened. It does not matter that we had an infectious disease like a COVID-19 virus. You do not know what's going to come next, and mpox happened. And we started to see over and over again, whether zoonotic diseases, environmental challenges, emergencies, or just the everyday chronic conditions that impact all of our lives, that we must be resilient, and that is critical to the work that we do. As an ER doc, the first thing and the only thing that I was reminded when you get to a code situation is first you have to take your own pulse. First you take your own pulse. What does that mean? I mean, it's not like I walk into a room, it's going to look not good that I'm taking my own pulse. That's not what I'm saying. Metaphorically, what you have to do in order to be calm and lead across systems is you have to understand your own leadership. You have to understand who you are, and how do you operate in the midst of the chaos. And when this administration first came into play, but I would say even when the Biden administration came into play, or even prior to that, you know that initially you are always trying to figure out what the changes are and what is your place in that. And I want you to remember that you cannot react. You must continue to act, but you have to take your own pulse first. And science and data are foundational. As Danny mentioned, I was honored to be the Secretary of Health, following the footsteps of the great John Weisman at the Washington State Department of Health. It is one of the most incredible departments in the nation when it comes to data and information and all the different things that talk to us about the importance of measuring things. Ultimately, we're all epidemiologists in some sense. We want to measure, but at the same time, we have to be thinking about how do we look beyond that. So Harris Cares was a report that was done back in 2019. Many of the very issues, the gaps across, the inequities across our community in Harris County, the size of Rhode Island, was there. And we really came up with a Vision 2020, which is similar to a Vision 2030 here in North Carolina. But really thinking about data, and then we launched in Washington State our transformational plan at the bottom, which was this real notion of how do we build after the pandemic, and certainly Be Well Washington, this perspective, again, in a blue state that kind of reminded me of the Make America Healthy Again agenda, because we were talking about movement, and we were talking about the importance of nutrition and emotional well-being and social connection. All of the themes that are there in the public square currently. But data are not enough. They are necessary, but they're not sufficient. They tell us the what, but we have to be telling the stories. And I want you, and I challenge you today to remind everybody of the stories of your communities, your staff, your people, what you are seeing every single day, because that's so critical in storytelling. Many years ago, I presented at APHA this notion about metaphors, the use of metaphors, and I do a lot of alliteration, imagery, connection. One of the big ones was that we are the offensive line of the football team. Everybody knows the quarterback. You may have heard me say this before. The healthcare system is the quarterback, but nobody knows who the offensive line is. Who's number 75 on the Carolina Panthers? Anybody know? I don't know. I just thought I would ask. That was my point. And the point is that when we do our jobs, it's largely behind the scenes and it's invisible, and we have to be thinking about the stories that connect us. Ziomi is somebody that I met after Hurricane Harvey, and she is, I met her a couple of times. I came back and saw her 1 year later, and she described to me, you can see on the bottom left sort of how high the water was in her garage as we were there. She had to evacuate her home. Ziomi and her husband evacuated. First they had to get through water, and then they had to swim a bit, and they finally got to a safe spot, and then they were rescued to an area hotel. And she described to me this notion about how the rain was dripping. She just remembered this notion of that it started raining, it was drip, 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 and then it became a true massive storm. When she got to the hotel, and it's Houston, hot summer, and every time the AC came on, it dripped in the drip pan. Drip, drip, drip. And she started crying. And that was post-traumatic stress. Post-traumatic stress that a year later was still there, and I'm sure that she still thinks about it. But we don't know if it's weeks, months, years, or a lifetime for people. But the point of that story is, one, that every story, every issue must be highlighted, because we can't just think about them as statistics. We have spent years collecting dots. It is absolutely time to tell the story and connect those dots. And we as Americans are very bad at connecting dots. We're not good at it. We are not. You have to sometimes really lead us to the connections, because we start connecting other dots. And we start connecting these dots and those dots. And we start going off. We have to come together and connect the right dots, because there are so many challenges and opportunities in health. And, I don't want to go through all these, but just to say, if you see these and you look at what you're going to be doing today, there's a whole notion of all the different impacts that we have, these opportunities and challenges that throughout, whether it's the digital age, whether it's how do we transform, how do we invest, how do we do so when there are less and less resources, there are more and more needs, the way people are seeing health and the trust in health and trust in institutions is at potentially at an all-time low. We have to be thinking about the social drivers, families, and how do we come together at a time and an age where it seems partisanship is there to be. That's where North Carolina comes in, and you have this real notion of the pulse of what is in this community. And I don't need to go through all this. You know this better than I do, but we have many agencies in many counties that are really working hard to serve the needs of North Carolinians every single day and night and weekends and holidays and special events like birthdays and weddings and other things. And I will tell you, public health people are the most dedicated. I remember during the pandemic, one of my staff members saying that, gosh, I'm gonna delay my my wedding because I want to make sure that I'm responding on behalf of communities. That you do not get that in any other field, and I would dare say you get that all the time, unfortunately, in public health, because we have so many urgent issues that come up. We heard about Medicaid expansion. Congratulations on Medicaid expansion. The concern being many of the cuts that are there, right? How do we sustain the real notion of progress when it's so fragile, when we come back and pull back? At the same time, we have to be thinking about the opportunities with rural health. As you know, Rural Health Transformation Program, the $50 billion that is going to be invested across rural communities for health over the next several years. There is a lot to be said about how that's going to be happening here in North Carolina. And then certainly Hurricane Helene, which I know a year later continues to be in the minds of so many people, with not just the lives lost, but the recovery having a long tail. And I will just for a moment remind everybody that we say in the emergency world that everything is 10x. So if you have 4 days of an emergency, you go 40 days of the immediate aftermath of that emergency, and then you go another 10x, 400 days, when it's not just the emergency, but it's the recovery. And you think, gosh, we're just the recovery, but it's 4,000 days when you're really looking at the long tail of recovery. We did not get our resources back after Hurricane Katrina response until Hurricane Ike, which was 10 years later. So think about that. There are urgencies and emergencies, and if you think it's only been a year, gosh, we should have done more. Yeah, there likely is the notion we should have done more for Western North Carolina. But at the same time, it's a long tail, and that recovery continues. Connecting dots across, again, won't go through all this, but just to remind everybody of the pilots and the partnerships that are there, the modernization and the workforce investment, that is key to the work. And I want you to be thinking about the rural health and equity as well as public-private partnerships, because the dots are there. We must have courage in connecting them. It's not good enough to say, gosh, this is not the right time. This is the right time. And I ask all of you to be thinking about how do you invest in the workforce, how it carries the system, and make sure the workforce has the tools to be effective and to be thinking about a new modern age, that innovation must be alive even when, and especially when you have fiscal constraints, and you advance the whole person notion of health, coalitions, and resilience, because we have to connect with people. Ultimately, people, policies, partnerships is the name of the game. Remember, I talked about alliteration. These are the 3 Ps. We have seen this invisibility crisis. I talked many times about this when I was NCIOM president, this notion that we have this hashtag invisibility crisis. I testified in Congress about this, that The invisibility crisis is very much about when we do our work, oftentimes people don't know that it's happening. It's behind the scenes. And what we need to be doing is thinking about how do we broaden that and raise that, what I call the 3 V's of public health. That you raise the visibility. When you raise visibility, society values it, they see it, it's tangible. When they see something, then they validate it with pro-health policies, resources, or both. But what I didn't know as the offensive line of the football team, or I couldn't imagine, is the other 2 V's of virus and vitriol, or violence, was going to hit our field with the harassment of public health officials. One day I woke up, I had 300 I was one of the few health directors that tweeted throughout the pandemic. One day I woke up with 300 new Twitter followers. I was like, woo, this is great. Then I realized they all hated me. I was like, okay, not so good, not so good. And we have to really be thinking about that real notion of what's the vision with the 6th V. So again, visibility, value, validation, virus, and violence, but also thinking about vision. What's the vision for the future? It cannot happen unless we support the very people doing the work, which is so key to our work. Because we have to move from this notion of silos of excellence. We're all siloed and we're all excellent. How many epidemiologists in the room? Woo! How many sanitarians or environmental health folks or lovers of the environment? Any lovers of the environment? Come on, that should have been something, right? Right? I mean, come on, I tried. How many clinical folks? Woo! Yeah. How many nurses? My favorite nurses. Yeah. All right. Woo! How come? That was like 3 people clapping for the nurses. Come on. Woo! We're all siloed, even in our field, right? The epidemiologists, the environmental, the clinical, the data people. And what we have to do is remind ourselves that it's not the silos within that we have to be excellent at, but we have to have systems of excellence, somehow lassoing all that so we're working across, not just within public health, but outside of public health, that it has to be notion of working with all the other sectors, and that's how you build the systems of excellence that are so key. So some of the pearls of wisdom that I've learned in the 20 plus years is this notion that our nation appears to be divided, and we have to be thinking about how do we acknowledge the fact that we are divided. But we also have to acknowledge something that I don't think any of us really want to take, very few of us want to take stock in. We have to acknowledge some of the failings of our own system. One, we don't have a system, but our field our field has not done well in certain areas. We have to say that. So when people come and say, we're going to build your system for you, we have to, one, acknowledge that there are some things that we are willing and able to acknowledge about our own field that we have to fix. And we have to say we have to be part of the solution, in fact, get out of our space so we can fix and reform our own public health communities. That's not said enough. I was at APHA last week, and there was a lot of, rightfully so perhaps, defensiveness. It's happening to us. We have to empower ourselves. We have to be thinking about how do we improve, but also acknowledge that we have to be honest with what's happening in our field. And we have to serve all sides. This is not about a left-right, blue-red. This is about all of us together. Vomit emojis and negative diatribes are not helpful. That's the second part of this. So what do I mean by that? Well, our secretary, HHS secretary at the federal level, was posting some things on LinkedIn, and there were public health professionals. The only thing their comment was vomit emoji, vomit emoji, vomit emoji, vomit emoji, vomit emoji. Now, whether you agree or disagree with what was being posted, I will submit to you, how do you find a path forward? I don't know the answer to that, but I do know that we have to be working together. I mentioned this, but I'll say it again, empowering our workforce to communicate, debate, build coalitions, and guard against the vitriol while learning to use the tools like social media and AI. Well, how do you do that when many of the very agencies let you do Facebook and X and all these things on TikTok and everything on your personal time, but on your work time you have no access to those? But that's where the community is. That's where my 16-year-old daughter is. She knows more about health and the news than I do that morning. She gets up breakfast, she's got the TikTok, she comes back, she asks me questions about what happened across the globe. I don't know because I'm not on TikTok. That's a big failing for all of us, and we have to be thinking about those tools as well. There is an urgency to this moment, but there is no cavalry coming. There are no wagons coming. If anybody did you see wagons this morning? They're not coming. We are the cavalry. We must step up ourselves. Because let me go back to that. There are kids in North Carolina right now, in Raleigh or Charlotte or wherever you want to talk about, who cannot wait for the 2 years. They can't wait for the next election cycle. They can't wait for 8 years from now. If you think we're just going to wait for somebody to finish a term, or maybe not finish a term, but finish a term and I'm going to just wait it out, those kids need you today. And you've got to figure out how to make those stories real. And that includes leveraging the partnerships and making the community visible. And this is the relentless pursuit of health. You have to do this in a way that's incessant, like there is no tomorrow. Scream it, yell it from the mountaintops. Yell it from the mountaintops. And take care of yourself, because you cannot get out of an empty well. If you are on fumes, there is no way for you to be able to take care of others. So remember that every single day. I want to show this photo of Hurricane Harvey. This was Houston, Harris County, under 1 trillion gallons of water in 2018. As you can see, it was right before the pandemic. This is the Houston downtown. You see the semi. We had gone through repeated emergencies. And I remember Anderson Cooper, CNN's Anderson Cooper, was interviewing J.J. Watt, who many of you may have known was a football player that played for the Houston Texans. And he asked him this question. He said, "What's the first word that comes to mind when you see all this?" And he said, "It's devastating." But immediately he said, the second word is inspiring. So in every emergency, every moment, every crisis in health, it's devastating. I am sure you woke up somewhere along this last path of 9 months, 10 months, 11 months, and you were devastated. You heard some news of something happening in Washington or something happening across the country or here in North Carolina or even across the globe, and it hurt you, and you were devastated. But I want you to think about Corrine and Jonathan Eichberger, who I met on the left there in Friendswood, Texas, and I asked them, how do they move forward when their entire homes were destroyed and all their things, their prized possessions, were in their front lawn? And they reminded me, you do what is necessary, then you do what is possible, and suddenly you are doing the impossible. I know you've heard that before, but I really want you to reflect on that. We have to be thinking about the baby steps to get us to where we, not just as a nation, but as a globe, need to be when it comes to health. The relentless pursuit of health. I want you to be that inspiration. It's not my dog. Just wanted full disclosure. He probably has my wallet, though. A little worried about that. The Kintsugi Bowl is this notion of a beautiful thing is never perfect, right? You break something, you put it together, and we think it's broken. It's worse. But oftentimes it's even better because we've learned from that. We've healed from that. We have to be resilient, strong together. So I did start my consulting after I stepped down because I didn't want to work for anybody at that time. And I had this real notion of what really drove me was the rickshaw. I've been a fan of a rickshaw. That's me in the bottom left when I had hair, and I was riding some kids around in Karachi in a rickshaw. And I will tell you that just as rickshaws get through crowded streets and all these crazy traffic patterns, and you're like, how did I get there? And you look back, it's this rickshaw that did it. Woo! Woo! Okay. So too is health. Ever-changing right now. It's crowded, and it is a challenge for all of us. We have to be thinking about how do we get to the other side, and I'm hopeful that we can do that together. Now, before I bring Danny back up and we get to our fireside, hopefully we still have time for it. Are we good? Are we done? Oh, okay. So I do want to show this quick video about leadership, and if you've seen this, I apologize. If you haven't seen this, I really hope you think about this because it really brings to light why what we're doing is so critical. Leadership isn't just about being first, it's about inspiring others to join. And all of us need to be thinking about how do we join the movement, the relentless pursuit of health for what we do on behalf of our communities and to raise the voices of those very communities. So here you go.
If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader anymore. It's about them, plural. Notice how he's calling to his friends to join in. So it takes guts to be the first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers emulate followers, not the leader. Now here come 2 more people, then 3 more immediately. Now we've got momentum. This is the tipping point, and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute, you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is overglorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
That has got to be one of the best videos out there. Look it up on YouTube. Let's be that first follower. Let's start that movement. Let's continue to be the leaders that all of us can be. Thank you so much for your time this morning. Want to make sure I keep my rickshaw.
Thank you very much for your time. Is this on? Can you hear me? Yeah. There we go. So thank you for your time today, and thank you for your presentation, especially that wonderful video. How many of the shirtless dancers do we have out here? So I gotta tell you, I mean, this table here is, other than you, was all Western North Carolina people, and all of us had a really big smile when we saw your 214 form with common sense, and we're thinking about going back and putting that on some of the ones that we had. So that was quite the image there. So you worked in Texas, which elected Greg Abbott as governor and Ted Cruz as senator. And you worked in Washington, which everybody here thinks is the left coast. Talk to us a little bit about how you're going to navigate, or how we should navigate, the political, the cultural differences, so that we can continue to advance what we need to do as leaders and do so in this political climate, because it doesn't look like it's going to change anytime soon.
Yeah, I think that's the question on all of our minds, and I hope that you will get from my presentation this notion that we have to be working regardless of the partisanship that's out there. You have to. There's certain things that are maybe immutable, right? Okay, vaccines work. Vaccines work.
Yeah, you can clap for that.
There are other things that we have to say, well, maybe, is this where public health is? Well, maybe this is where we focused on. Maybe we shouldn't have. Maybe the tent got too big. Maybe there's some things that we need to refocus, right? There are certain things that I say, make sure that's your line in the sand. But there are other things that we can have a conversation about. Let's have those conversations. Now, you may feel that it's hard to do right now because when you have real funding going away, or you had a federal shutdown and SNAP benefits and your neighbor was having the impact on their families, it is a very dark place to be, to say, well, it's easy for me to be up here and saying you should do X, Y, and Z. But I think we have to remember that regardless of, and the two people you mentioned, Governor Abbott or Senator Cruz, these are people I know. I also know Governor Inslee. They're all people that are people. Now, their motivations may be markedly different, and they likely are, but I think what we have to be thinking about is how do we come with not just our data, but how do we come with the impact on our community? And I think that's the key that we miss, is how do we tell the story of what's happening in the community? By the way, who are their constituents? They're their constituents. So when you cut the CDC or the NIH, or you do something, you're also impacting the constituents of the very people who are being impacted. And I think that is something that we have to be really
Does today's media, like the social media, the TikTok stuff, make it harder because you don't see the people? When I started working for elected officials, there was a lot of handshaking. We went to every rubber chicken dinner and bean dinner and all that kind of stuff, and ate terrible food so that we could shake hands with every person we could. We don't do that anymore. Is that making it worse?
Yes. Not only is it making it worse, I think we have to become a little bit less about the notion of being exactly precise on how we tell the story. And let me unpack that. Governor Inslee, I remember one day he was talking to me and our team about vaccines. This is early in the process, and that time we were giving X number of vaccines, and what he was asking is, how many vaccines a day are we giving across the state of Washington? And my team started fumbling. It was like 13,524. Someone was like, oh, it's 13,646. That was 14,401. I mean, they were just going through it. Not only did they have different answers, which was, by the way, another story, but they were looking for the precise number. But what he was asking is, about how many? He didn't say about. He just said how many. He was just looking for just shy of 15,000, 10 to 15,000. We're so much about trying to get the precise number that we lose the story and the community. And I think that's a real challenge. And the other challenge is that the public health speak, the put your stethoscope on and your white coat speak, it does not engender you to community. We've got to show that we are a part of community. and that community trusts you when they see you a part of community. It can't be that it's this notion of we've got to be precise, we've got to make sure that, we are giving you the expert opinion. So when we were giving COVID vaccines, I remember what I came out with was this notion about not being a secretary of health, a public health practitioner, a physician. I said, as a father, as a husband, my wife and I, every single day, we're worried about the health and well-being of our kids. The health and well-being of our kids is like the health and well-being of all the kids across the state of Washington. And that changed the narrative. And we don't do that enough. So when social media comes after you, or it's extreme, it's hard to break in, we are not good at the tools. Folks, if there is one thing that should come out of this, you've got to be really good at communicating, and we're not. We're not good enough. We're not good. We're not even good. We're actually really bad at communicating in the social media world. And we've got to learn the skill sets, and it's not coming from public health. So if there's anybody in public health who's going to try to solve that, do not. Find people in other sectors who have solved it and come back and market it within the field of public health, because we're not doing a good enough job, and we're never going to get there.
So let's talk about another sector. Public health and healthcare sometimes get separated. You talk about those silos. Hospitals here, the health departments here. They don't play nice together always. What are some promising ways that we can bridge that together so that we can look at populations like whether you're as big as North Carolina or talking about Burke County, where I'm responsible?
Yeah, I think this is where, the 20 years as a ER doc and, having the opportunity of really knowing what's in the healthcare space really makes a lot of difference. And I was not joking when I said nurses are so powerful. They're so amazing. They're the ones who really are the backbone of the healthcare system. And they're also leaders who know what's happening with their patients. And those patients are individuals. Those individuals are part of the community members who we're trying to elevate. So all of it is interconnected. And so when Secretary Sengvai talks about this notion about how do public health and healthcare together come to the solution, the clinicians in the room have an obligation and a responsibility for being part of that solution. And so I think what we have to do is highlight those opportunities of where we are partnering, where we are working. And so I talked about, where Duke was coming together, and there was an opportunity of really looking at the children's hospital and some of the pediatric things. Kids are an incredibly powerful way of getting, hi, I didn't see you there. There is an incredible, powerful way of really getting kids to be this real impetus for us as adults to do something. And we have to speak their voices. And please, you're going to hear more about this a little bit later with my colleague here. Raise your hand. Hey. I will tell you that that's what we have to do, is we have to elevate the stories, but show programs where public health and healthcare delivery have been successful, must come together in a complementary way in order to enact the benefits for that community. And that's what we have to be doing.
So Michelle's telling me we got just another second left.
Okay.
I want to keep on time so I don't get on her bad side.
Yeah, I get to go back without my wallet back to Seattle. Yeah, there you go.
Give everybody 2 key takeaways they can take. They can go home, and we're assuming everybody's going to take Friday off. And when they get back to the office on Monday, it's something they can do.
First is this real notion. You've got to figure out how to communicate better. If you think you're a good enough communicator, you suck. Sorry. That was a completely out of government term. I'm not good at it. I suck. We all are really bad at this. We've got to be better. That is so critical so acknowledge it, move past it. Embrace the challenge. We got to get better. Invest in it. That's the second one. Invest in the things that are very much about, they're hard to, you can invest in epidemiologists, you can invest in sanitarians, you can invest in data people, but what you don't invest in are the behind the scenes cameras and all the different things that are going to help you raise the visibility of the work so that people value it, they validate it, and that is so critical to what you do. So you asked for 2, I gave you 3. It was visibility, value, validation. Do whatever you can to raise the visibility, and you can't do that unless you get better at the communication skills.
Dr. Shaw, thank you for coming a long way, a little over 3,000 miles, I think it was, to come here. We really appreciate what you did. And I want to take this 1 second to say, because we've not talked a lot about it. So I've been a board member of the NCIOM. This is my second term. I'm always more than pleased with the quality of the work that the staff does and how much effort they go in to make sure that these things go right. There's a lot of effort that goes into planning meetings like this, planning the task forces. So let's give the employees here a round of applause for all they've done for us.
And before we walk off the stage, I did want to recognize Danny. For those who don't know, he received APHA's Romer Prize last week for innovation in public health at the local level. And Danny, just congratulations on that.
Thank you.